Hi everyone, and welcome to the last day of Refresh 2021. It's been a fantastic week and we've only got a couple of guests left. So today I'm going to welcome Jimmy from Terrance Higgins Trust. Hi Jimmy.
Hi Katie.
Jimmy's been one of our college partners for over 6 years now, and he helped me to launch the first sexual health service that we had at the college, which has been absolutely fantastic and a real game changer for lots of our students. So prior to lockdown, Jimmy would come into the college and carry out sexual health testing with staff and students alike, and he would also deliver education sessions in class, and also had a host of volunteers that did various things with him. So today we've got a variety of questions that have come in for Jimmy from our students, and now Jimmy, you're in the hot seat. Are you ready to go?
I am, yeah, I'm looking forward to this.
Great stuff. Okay, Joe. Okay. Right, Jimmy. Okay, we're just going to throw you right into the deep end here, okay?
Go on then.
What are the most common STIs in Dundee? Now, Jimmy, before you start, I think what we'll do is just make sure that any students that are watching this now or later, they know what an STI is.
An STI is a sexually transmitted infection, and it's sometimes known as STD, sexually transmitted disease. More and more, there's a difference being placed on importance being placed on the difference between infection and disease. So STIs are infections, sexually transmitted infections. There are 26 known STIs, and the most common out of all of them are syphilis, chlamydia, gonorrhea, and including things like hepatitis B, hepatitis C, and HIV, because they're blood-borne viruses as well. So we include them in the general umbrella of STIs. But the main ones, not just in Dundee, but throughout the UK, chlamydia, syphilis, and gonorrhea.
Okay, thanks, Jimmy. Now, there was a question later on that I was going to ask, but I think I'll just ask it now because it's probably more relevant. I think a student asked about syphilis and said, is it true that syphilis is going round? Because that's what my dad said. But then my mum said, no, it only happened during the war. Do you want to shed any light on this one, Jimmy?
Well, some people who are of an age and perhaps older will use terms like that and think of it in those ways, because they think automatically that because we've got medication, those infections don't exist anymore. And it's like the old word, the clap. Obviously, they can be pejorative terms, and we don't use them anymore. Syphilis is definitely still a thing, and it's at epidemic levels and has been for about 3 or 4 years now. And with NHS Tayside, we did a public health campaign 2 years ago, actually, warning people of the dangers of the fact that syphilis was on the increase, particularly amongst men who have sex with men, but definitely not limited to that demographic at all. As a result of lockdown, all STIs, the main STIs, chlamydia, gonorrhea, and syphilis, have all just shot up.
Wow. I find that really hard to believe because we're in lockdown.
People are still hooking up in lockdown.
Yeah.
And we know that. And, you know, from a public health perspective, we're saying we do know this, but we have the opportunity to provide you with support and help and advice. So, for example, in 2019, the most common STI is chlamydia. And in 2019, in Scotland, there were 17,000 diagnoses of chlamydia.
Wow. That's a massive number.
It is. And more than 64% of those diagnoses were in people who are under 25.
Oh, really? All right. Okay. So that kind of links to our next question then. One of our female students had a message in to say, do young people get more STIs than older people?
It's not age. None of it is age related. It's all to do with what sex you're having, how much sex you're having, and whether or not you're using barrier protection, so condoms or
Okay.
femidoms.
Okay. Okay.
These infections, as has been proved time and time again, age doesn't matter.
Probably as well because you've got far more divorces now than what you used to. So people are going out and having that kind of second life, maybe?
There is an element to that, but
Mm-hmm.
what we find is that because there's less information available, and people from a younger age perhaps aren't being told what they should be told in order to help protect themselves when they start having a sex life. That's why younger people are becoming infected more.
Yeah.
And also, you know, when you're younger, you're invincible. You think nothing's going to impact you at all. And the number of times I've had a young person in front of me who has had to be told that they have syphilis or another STI, and they break down and they can't understand why they've been infected. You know, and
Yeah.
we've just gone over their sexual history where they've had multiple sexual partners and none of the sexual occurrences have happened with condoms.
Yes. Yeah. We used to deliver a very basic kind of condom session to our students years ago. And every year, it didn't matter how old the student was or how young the student was, the belief was that only females were affected by chlamydia, males were not affected by it at all. And all the other diseases that you hear about and you see posters about were out of date and they weren't current.
Yeah. And I
Scary.
think that's there's a gap there. I think, Katie, there's definitely a gap where that we need to plug. Certainly, chlamydia historically, women were more likely to get it. I won't go into the technical details of why, but that's not the case anymore. And when I look at the chlamydia infections that I've recorded as positive over the past year, far and away, it's men.
Oh, really?
Yeah.
Guys, are you listening? Take note. Okay. Okay. Thank you, Jimmy. Right. So THT, Terrance Higgins Trust, and Men Only Tayside are partner organisations.
Yeah.
So a question here. I know your organisation supports gay people, but I'm not gay myself. Do you test straight people too?
Absolutely. We're not an organisation that limits itself to supporting gay people or LGBT people. There is a huge amount of stigma, and I think we can come on to that a bit later. But we support absolutely anybody who needs help and advice when it comes to matters of sexual health.
Good.
And the clinics that we've got, the Men Only Tayside and the THT pop-up community clinics that we'll have, tend to target men who have sex with men because they are the hardest to try and get into clinics in order to take care of their sexual health. And that's why it's a key demographic, because historically HIV and AIDS was affecting the gay community, the gay male community, far more than any other community. But we don't limit ourselves to a demographic. We test everybody on the basis of need. So right now, where we have very, very, very limited face-to-face consultations, there's my clinic in Dundee on a Thursday, and there's another clinic that we do down in Lanarkshire on, I think it's Wednesday or a Tuesday. They're really the only two face-to-face clinics in Scotland that are dealing with sexually transmitted infections at the moment. So I will triage anybody that gets in touch on the basis of how urgent is the need, do they have any symptoms, are they at risk?
Okay. Thank you, Jimmy. I'm going to jump questions again because there was something that came in. Do straight people get AIDS too?
Okay, let's talk about the difference between HIV and AIDS. HIV is the virus that you get which compromises the immune system, human immunodeficiency virus. When the immune system is left compromised, not treated, not helped, it begins to weaken, and the body therefore can't defend itself from infections. And that's what's called at that point, used to be called AIDS, acquired immune deficiency syndrome. So the key word there is syndrome, which is a collection of unknown infections from unknown sources, except now we know what the sources are. So we tend not to use the acronym AIDS anymore. We tend to say late stage HIV or advanced HIV, because there are very few deaths now, certainly in the UK, that are HIV related. Going back to part of that question, anybody can catch it. It's a blood-borne virus. HIV is a blood-borne virus that exists in blood, sperm, anal mucus, which is the lubricant that wraps your poo, vaginal fluid, and breast milk. So HIV does not live in saliva. You cannot catch HIV from sharing a cup. You can only catch HIV from direct transmission from an infected bodily fluid into a bloodstream.
Okay.
Does that make sense?
Yes, it absolutely does, yeah. I think the misnomer is still that people believe AIDS is only passed through gay sex. So,
Again,
and that was a really good answer, thank you.
well, again, it comes back to lack of education.
Yes.
And stigma. We still live with the stigma, which is a hangover from the 1980s. I don't know if anybody's watching It's a Sin at the moment.
Oh, I did watch it. I was crying. It was really, really thought-provoking. Yeah.
The reason that we are in existence is that in 1982, Terry Higgins, who's a 37-year-old gay man, died in excruciating pain, with mental and physical, in St Thomas's Hospital in London. And a few of his friends got together, obviously to provide him with support, but realised that there were many other men, and in an increasing number of men in their position. So they got together to provide a support group, and 2 years later they got charity status, and effectively that's a quick history of our charity. But it was known as the gay plague, and then there was nowhere to go for help. There were very, very, very few health services that were able to help men in that position. And actually, the prejudice, and this is, I think, touched on in It's a Sin, the families of men who were dying of AIDS at the time very often didn't realise that they were gay. So it was a double whammy, and very often those men were disowned by their families, not
Yes.
because they were dying, because they were gay. And that still provides us with a massive hangover of stigma now.
I remember it when I was young. I remember it always being on the TV, and the kind of scare tactics, and the adverts were dark and awful. And I think there's an older generation that haven't been educated since then, and they're the ones that now have children, are young people who are thinking, well, I'll never get that. You know, I'm
And
not a
that's,
gay.
well, and actually, that's a comment in all of the sessions I've done at Dundee and Angus over the past few years. I get so many comments like that. And it's a lack of education. People don't realise that HIV actually has not gone away, and it's still at epidemic levels. Since the virus first landed and the first people were diagnosed back in 1981, the World Health Organization estimates that around 36 million people have died as a result of HIV and AIDS.
Wow.
So if you think about the total number of deaths since COVID-19 started, and have that worldwide for 20 odd years, that's what HIV did. But because it first affected the gay male population, it was instantly stigmatized, and it was just left alone.
Yeah.
So a great part of my job is not only sitting with people in one-to-one sessions or doing sessions like this, and these sessions are really wonderful, and so thank you so much for inviting me here today. But it's making sure that information gets out, and it's making sure that people have access to that information and know where to go to get information that doesn't come with any prejudice.
Yes. And that's one of the reasons why we have our partnership. I mean, you remember this, Jimmy, when you first started, we started meeting and having a chat. We carried out research with our students, hundreds of them over all 3 campuses at that time. And the feedback was, they didn't have anyone to talk to. They didn't want to talk to their GP because mum or dad or guardian had the same GP and they weren't sure about that kind of confidentiality. They didn't want to or didn't have the money to get the bus at the time because we didn't have free transport back then up to the gum clinic in Nine Wells. And they just felt completely stumped. And they wanted a person, you, to be there on campus to deliver that service and to have the knowledge to share with them. So it's very, very important.
And those clinics really do prove that when you take a service to an area, people will use it.
Yes. I remember how shocked we were the first time there was a queue of people outside the glass room. Remember, and we covered the glass room with posters, and there was a queue of people, staff and students, standing proud, looking after their own sexual health. And it was a real game-changing moment for our team, kind of knowing that, it's a real community campus and we're trying to bring the community into the college and offer these services to our students. So thanks very much.
I always get really excited when I see that. And what excites me more than anything else is the recognition that people are doing something about their sexual health. And, we say, normalize it, treat it like going to the dentist or, MOT, men only Tayside, MOT. It's that acronym for a reason, because we want people to recognize that if they're having sex and if they're having good sex, which is what we promote, then come and get checked regularly.
Yes. Male or female, regardless of your age.
Male, female, straight, bi, whatever, trans, cis.
Yes.
Just make sure that you know where to go to access sexual health services and make use of them.
Great stuff. That was a great answer, Jimmy. Thank you. Okie doke, what have we got coming in? I'm not on campus because of lockdown at the moment. Can I get tested in Dundee? Now, Jimmy, what I'll do is I'll ask you a second question on top of that one, because that was from a Dundee student. But if an Arbroath student was to have messaged in, is there testing in Arbroath too? Or in any of the rural areas? Okay.
No. I have, and I can post the details in the chat and links in the chat. We have a clinic at the Cairn Centre, which is the Harm Reduction Centre, the old MOT clinic on a Thursday night. That's by appointment only.
That's in Dundee.
In Dundee.
Right.
Terrance Higgins Trust also has free HIV postal test kits for people to use. And if someone's nervous about using the test kit, all they need to do is give me a call. We can set up a Zoom session and I can walk the person through the test. And obviously then I'm there on hand to provide any support for when the results happen, because the results from these instant tests are delivered within a few minutes.
Oh, wow. Okay. So just to clarify then, you post the test through the door, it comes through with your mail, and you can administer it yourself from the house?
You can administer it yourself from the house.
Okay.
Somewhere preferably in private, not in a cafe or at the bus stop. Make sure you're at home. Make sure you're somewhere private and confidential. And what you do is you do the test and then you text in your result.
Okay. And the information will be there for where to text it?
All the information is there. So if someone gets a reactive test, they're given advice on where to go immediately to get support. That advice is from THT, but I'm always around for people if they need some help. But also, it allows people to take control over when they do the test themselves.
Yes.
And it takes anxiety away from potentially going into a building that might intimidate them, into a setting that they're not comfortable in, or it just makes sure that they're in control of doing it themselves.
Yeah, it's a fantastic idea.
And what we're actually looking at now is how we can provision STI home tests. So that would be chlamydia, gonorrhea, and syphilis as well.
Okay, so at the moment it's HIV testing, but in the pipeline are other STIs. Okay.
Yeah. So if anybody feels that they need to test, they can get in touch with me. We'll do a bit of a triage, find out what's going on, and if it's necessary and there's a risk, we'll get them in for a test.
Okay, good to know. I think what we'll do, Jimmy, is there's a lot of information here, so we'll maybe post the key facts on our Facebook page after this.
Yeah,
okay,
great.
Okay, right, next question. How many STI tests should I have in my life?
When I heard you say that, I omitted the word tests, and I just said, how many STIs should I have in my life? Okay, none. But bear in mind that all STIs are treatable and curable. So if anybody tests positive for syphilis, chlamydia, or gonorrhea, there is treatment and it can be cured. And including Hep C as well. That's not the case with HIV, but there is treatment for HIV. In terms of how many tests you have, that's driven by how much sex you're having. So if someone has a regular partner and they're in a monogamous relationship, if they want to come and get a test once or twice a year, then that's great. If someone has frequent and different sexual partners, I would suggest they come and get a test every 3 months or every 3 to 6 months. It depends on the number of partners. If it's in a 12-week period, if it's 2 or 3 partners or 3 or 4 partners every 12 weeks, I would say come and get tested every 12 weeks. So once every 3 months.
Some of the male students that we spoke to before, who seem very responsible. He's back. We lost you there for a second, Jimmy. A couple of them said they actually got tested before, or sorry, after a different partner, to make sure they were clean. So when they went out clubbing, then maybe the next weekend, whatever, they knew they can go and have sex without contraception. I mean, what are your thoughts around that?
No, because each of the different STIs has a different window period. So, for example, syphilis has a 4-week window period. So, if someone has sex today, the blood test wouldn't detect that for another 4 weeks.
Oh, really?
So, if someone had sex today and wanted to go out clubbing next weekend and went for a test next week, if they came to my clinic, I would refuse because there's no point in testing them because the antibodies don't appear in the bloodstream so quickly. And these are all NHS and World Health Organization guidelines.
Okay.
And they vary. HIV can be detected in the bloodstream within 72 hours of a risky encounter. And if it's not within 72 hours, then I would suggest 6 weeks for a test, and then 6 weeks after that for a confirmatory test, because the WHO suggests 3 months.
Wow. So I guess what you're asking people then is, after you've had a test, you're adhering to the time afterwards and not going out and having free sex or sex with a contraception.
There's always that, and be aware of the fact that just because you have sex today and get a test next week, if you have something, it might not show up on the test.
Okay.
So just be aware of that. Of course, the underlying message is don't put yourself at risk and always wear a condom.
Yes, yes.
However, STIs like chlamydia especially can be transmitted by oral sex. So that's another reason to get tested regularly.
I didn't know that. That's really interesting.
STIs like chlamydia will sit where they're put.
Okay.
So if a penis goes into the mouth as part of oral sex and that there's a chlamydia infection there, chlamydia will stay in the mouth. Which is why we use the big cotton buds to go down the throat to check for that. And it's the same, those buds are used to check in the anus and in the vagina as well. And we also do...
My mind is blown.
I don't do that.
So old and boring.
We get our clients to do that themselves because those tests are easy to use.
Okay.
But just bear in mind that even if you do wear a condom, and you have oral sex, there is a risk that other STIs can be transmitted as part of oral sex.
Okay.
And also using your fingers. So if someone uses their fingers on someone's vagina and then touches their eyes or anywhere that might have access to a bloodstream, that's a potential infection risk as well.
And would you know what would you know you had an infection?
70% of people who have chlamydia won't have any symptoms, so will not know that they have it.
Jimmy, I'm going to ask you my own question here. This isn't a question from the students, but again, I'm probably very naive in this area, but I'd heard that chlamydia could cause infertility in women. Is that true?
It can.
It can.
In extreme cases, left unchecked, many STIs can cause a number of very, very awful things to happen. Kidney function problems, liver function problems, and in some cases, dementia and death. So the old stories about, the madness of King George and things like that, and people going demented because they'd caught something. That's actually based in fact, and those things can happen. It's extremely rare these days, but left unchecked, sexually transmitted infections can be horrible.
But like what you're saying, they probably are getting left unchecked because there aren't any obvious symptoms. It's not like you're growing warts everywhere or you're going green. So actually it's about being more proactive and getting tested because it's the right thing to do than being reactive and only getting tested because you've got an itch or you've got a spot somewhere.
Oh, well, a spot somewhere or a little rash, I don't want to freak people out, but a particular kind of spot can sometimes identify a syphilis infection. So if you look at some of the campaign posters that we put out a couple of years ago, and I can send you them again to put up on Facebook, these little fiery red spots, if they appear on the genitals, that could indicate that syphilis is present.
Okay.
And that would be a symptom. So that would mean then that whoever has that should phone NHS Tayside Sexual and Reproductive Health Services up at Nine Wells, describe that to the triage nurse, and then they would immediately get seen and put on treatment.
Okay. And is that likely to happen? I mean, is that happening out there just now?
Yes, it is.
Yes.
It is. I have had clients come into the clinic ostensibly just for a checkup and then describe something. One guy said to me, "Oh, I've got this on my dick. Is that normal?" So the answer to that is, if it looks unusual, no, it's not normal, and get it sorted out, get it checked out. Left unchecked, that could then develop into something else. So in England, we're seeing more cases of a specific strain of chlamydia right now, LGV, and that has some very, very definite symptoms. And I have had someone describe to me the fact that they had a lump on their penis, and to get an erection was painful. And I referred them directly to NHS sexual health services, because that is something that is symptomatic of chlamydia.
Wow.
So don't hang around. Don't play about with this. As we've just said, the best way to do it is get checked out regularly. If you're having sex regularly, come and see me, and we'll make sure that you don't have any infections.
And if you do have any infections, then you'll know how to get them fixed.
Yeah, because I refer you directly into sexual health services at Nine Wells.
Okay, thank you, Jimmy. Okay, we'll move on to the next question. Does an STI test hurt or make me feel sick?
It shouldn't, but people do react in different ways. So syphilis and HIV, they're just a finger prick test. So it's like an allergy test or a pregnancy test. I have had some funny reactions to that, but that's all it is. It's not actually an extraction of blood. For chlamydia and gonorrhea, as I've said, it's a cotton bud down to the back of the throat, yay far up the bum and up the vagina. Obviously, it's not the same one that does that. It's two different ones. And there's pee in a pot as well, which checks for gonorrhea. So,
I mean, I can vouch for that too. I mean, we've had queues of students and staff having sexual health tests over the last, what, 5-6 years, and I've never seen anyone coming out sick or unwell or reported anything. So, and it's immediate too. So,
well, I always ask for the finger prick test. We always ask if the person's nervous at the sight of blood, because some people just are. I did have one person recently who went very pale and broke out into a sweat. So we got them lying down and had them resting for a little while, but that's about the only reaction I've ever had.
Okay, and I think that would happen if you were just giving blood ordinarily. It's not because it's an STI test. Yeah.
Well, people react even more strongly to that. So I would say that the finger prick test for syphilis and HIV is no more intrusive than getting a flu jab or something.
Okay, that's good to know. Okay, thank you. We've got a couple more. I would like advice on how to tell my parents that I may be gay. Where can I get this information, please, Jimmy?
Ooh, that's always going to be a tricky one, because telling someone that you're gay is a very, very personal thing, and it's a very big thing for many people. For some people it's not, but for many people it is. There are a number of organisations around Tayside and Angus that can help. I can help. I can always have a one-to-one with someone and talk about the situation. There's LGBT Youth Scotland, who are really well placed to help, especially young people, with coming out and how to approach it, how to approach that subject with their parents. It's a very individual thing, because only that person knows how the land lies with the person that they want to tell, whoever that may be, whether it's a brother, a sister, a parent, or a friend. And a lot of that comes down to personal judgment. But before that happens, we can help. LGBT Scotland can help, and there are a couple of other groups around as well that can help in helping someone prepare for that. Making sure that, for example, when you tell someone that you're gay, you're not in a public place. You're in a comfortable space, but more importantly, somewhere that makes the person who has the story to tell feel comfortable and safe.
Yeah, that's good advice. We also have, well, you know this because you support them, we also have our own college group run through the learner engagement team, and it's the Rebels of Our Growth.
I was trying to, I didn't say that because I couldn't remember the name.
Well, you've visited them a couple of times, haven't you?
Yeah, I've been down to Revels on a Monday a few times. It's one of the things that I really miss about lockdown. One of the many things that I miss about lockdown is I'm more involved with Dundee and Angus College than just about any other organisation. I think that's partly because you're such a massive organisation. I really miss all the activity and the interaction I have with those students, because they seem to enjoy it. They seem to get something out of it. And, if they're learning something in a non-threatening environment and they're benefiting from that, then that's great. It really is.
That's it. That's what college is all about, isn't it? It's not just kind of 9 to 4 learning in a classroom. It's everything else that goes along with that.
It's much more than that, because I think increasingly with online services and the online world just getting so big, I think people are beginning to look for face-to-face sessions more.
Yeah, I would agree with you. Absolutely. Okay, we've got a couple more, Jimmy. Where can I get free condoms and lube in lockdown?
If I can put something in the chat box. Where is it? Effectively, it's On the Men Only Tayside website.
Okay.
I don't know how to post something in the
Do you want me to
chat.
do it? Do you want me to do it, Jimmy?
It's
I
all right.
guess.
I'll send you the link, and you can put it on the web page.
Okay, doke. Are you doing deliveries?
Yeah. So what people can do is they can go onto the Men Only Tayside website. It's menonlytayside.com/condoms/by/post, and you can order condoms and lube and get them sent free, safely, and confidentially to your home address.
That's fantastic. Any age?
Any age,
Okay, great to know.
as long as the person's over 13.
Okay, okay,
Any sexual activity under the age of 13 is classified as rape.
okay, I didn't know that.
Yeah.
Okay.
Under the age of 16, sex is illegal. So, for example, when we were at events at the college, if someone looks as though they might be under the age of 16, we would always ask them what they're going to do with the condom. Do they know what the condom is? Do they know what they're going to do with it? You know, and in some schools, they basically use them as boxing gloves sometimes, or they fill them full of water and throw them over the balconies at their mates and stuff.
We've had that at the college too.
But there's always a safeguarding element that we have
Yeah.
to do, because it's part of our job to make sure that whoever's asking for the condom is asking for themselves and they're not being coerced into it.
Yes.
And also that they know exactly what they need to do with the condom. So, do they know how to put a condom on? Many people don't.
You're absolutely right. When we used to deliver these kind of condom sessions, when the C card came out,
Yeah.
we used to take the plastic penis and the condoms, and you'd be really surprised how many young people didn't know how to put it the right way around, and how many girls had said, one got stuck inside me all night and I couldn't get it out, and it's because he put it on the wrong way, and the horror stories that we heard. And I just think if everybody just had the same education, you know, you learn how to put a condom on, you learn how to work a washing machine, you'll be fine.
But don't wash the condoms.
No, don't wash the condoms.
Don't
No,
use a condom more than once. Always use a fresh one.
they've not been designed yet, but they might. Like your
Well,
sanitary pad, your period pads now, you can wash them.
can you?
Oh yes, you can.
Really?
Oh yes.
I didn't know about that.
Oh, there's fantastic new Fandango pants that you could wear and wash. And there's reusable pads that we're sewing at the college. And oh yes, I'm sure
Well,
condoms are just around the corner.
I can see Tatiana's on the chat, and she's
She
our
could knit you one. She could sew you a condom.
she's
Knitting
our
pad.
she's our tampon czar now, isn't she?
She certainly is, yes. Yeah.
So I didn't realise that that was the case. But log on to Men Only Tayside's website, find services, and actually on the left-hand menu it says free condoms by post, and just fill your boots. But beware of the use by dates. They're normally 2 to 3 years in advance, but condoms do have a use by date, and it's important that people realize that, because if the condom is out of date, then it is less likely to work. It's more likely to break. Actually, here's an interesting question for you. Thinking about condoms breaking. Could a lipstick break a condom?
Could a lipstick break a condom?
Yeah.
As in putting the condom on the lipstick?
If lipstick comes into condom, do you think the lipstick could cause the condom to break?
Oh, that's a good question.
It can,
Can it really?
because there are oils in lipstick, and oils will rot the latex and break it.
Wow.
So when I'm giving sexual health awareness sessions, I always say to people, and let's take gender out of it, if someone's wearing lipstick and they give someone a blowjob and that person has a condom on, then the condom could break. So don't use it for penetrative sex after that.
Okay, that's
And
really good to know.
actually, the same goes for kebabs. So if people are on their way home after a night out, they get a kebab and then try and use a condom. Apart from the fact that, mind out for the chilies, um, any grease and oil that's on their hands as a result of eating their food could rot the condom and breach it.
Really?
Yeah.
God, I didn't know any of this.
You
Does
need to be
anyone know
careful.
any of this?
You need to be careful.
You have to do a fact sheet, like a 10 things that you should definitely know about condoms. God.
Don't have oil on your hands and and handle a condom. Which is why for many years now, it's always been said that if you need to use a lubricant when
Uh-huh.
you're having sex, either for anal sex or vaginal sex, use a water-based lubricant and not petroleum jelly or
Oh my
KY
God,
jelly.
that was my last question. My
Oh,
last
was it?
question was, can I use Vaseline? It actually says lip balm Vaseline instead of lube.
No, 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 no.
Okay.
Apart from the fact that that could cause um, abrasions on the inside of either the anus or the vagina, no, do not use anything like that. Use a lube that is meant for that purpose.
Okay. And do you also provide them as well as the condoms?
Absolutely. All free.
Great. All free. Did you
All
hear that,
free.
everyone? Lube and condoms, all free, delivered through your door. You just have to follow the link in the chat. I think Jason's put it in. Yes.
menonlytayside.com, and you go in there, find services, and it says free condoms. It's easy to find.
Oh, that's fantastic. I wonder if it's like this in every country. I just think, we have the facility to deliver to our students food parcels for those in need or those self-isolating, sanitary products to anyone that needs them, contraception to anyone who needs it. I mean, that's amazing, right? Is
Yeah.
that a Scottish, British thing, or is it global? Does everybody, I mean, I know it's not global, but I feel like we're very lucky.
In Western Europe and North America, you find more of these services. We are very good here in the UK, but I think we're groundbreaking here in Scotland. I think
Yeah.
the sexual health services, plus all the other services that we make available to people, um, I think they're second to none. There's always room for improvement,
Mhm.
always. But certainly, we do what we can, and that's the NHS and all the third party organisations that the NHS works with, including us. And actually, colleges and universities as well all do what they can from a community perspective to make sure that whatever is needed is supplied. It's a person-based service design concept.
Yes.
What does that person need to make them
Yeah.
safe and happy?
Yeah, it's very true.
And we just try our best to do that.
Yeah, we do. Jimmy, I've asked all the questions the students have sent in. Um, is there anything else that you would like to add? This has been a great chat.
I've really enjoyed it, and it's actually the first chance I've had to do this in quite a long time. I never normally get nervous when I'm in any of your campuses and talking to your students, but I was a bit nervous coming on here today,
Yeah.
and I think that's because I can't actually see people in the room.
Yeah, I feel the
Does that
same.
make sense?
Yes. Yeah. You're not getting the vibe from people and the nod and the wink and the thumbs up and the interaction. We all feel the same. My whole team are trying to deliver online at the moment. And, we're all real people and we love that interaction and the buzz of being with our students. And it's a challenge sitting like this, you know?
I remember giving a session at my old school in Dundee and to a bunch of 60ers, and I was talking about where HIV lived and what bodily fluids it existed in. And when I said sperm, there was a group of girls in the front row who just burst out laughing. I looked at them and I said, "Yeah, I'm a professional. I can say sperm and I can say spunk. Whatever makes you more comfortable, whatever makes it easier to understand." And you then play that conversation back in your head and you think, did I just say that in public? But it's actually getting the feel from who's sitting in front of you, allows you then to kind of tweak the way that you communicate with them.
Yes. Yeah.
This is difficult. This is not easy. Our
Yeah.
chat, because we know each other so well, is free flowing.
Yeah.
Ordinarily on this kind of format, it's very difficult.
It is very difficult. One last question just from me. I mean, your job is it's very specialist and sensitive, I guess. And like what you've just said there about using the word spunk or cum or whatever, how do you're so good at engaging with our students, you always have been. And is that because you kind of bend and flex your style and you know when to put the professional hat on and you know when to use the kind of more street language or lingo that young people use, or, because we've never been short of people coming and having a chat with you, Jimmy, or indeed getting a full STI check or asking questions about different things, and in case that doesn't come across in a kind of more an online kind of staticky kind of film like this, it's good to know that you are a partner of the college, and when things go back to normal, you will be there for students to talk to. You can be reached at the end of the email or a phone, and if this hasn't come across in our chat, guys, believe me, he's the best person for the job and fully supportive. And so, yeah, tell me a wee bit about your job, Jimmy, and about your style, and what do you enjoy about it?
Well, we have to be able to understand people who are sitting in front of us, and they're not always going to use the language that we use. They're not always going to use proper terminology for body parts or whatever. I roll out on behalf of NHS Tayside LGBT access to sexual health training. I would encourage people to come along to that. And one of the first exercises we do in the rooms when we're actually physically there as well. And it's getting people to, on 2 pieces of flip chart paper, on one, write down all the words they know for genitals, and on another, write down all the words they know for sex and sex acts. And
how many words do you get?
I learn something every single time.
Really?
I learn something every single time. It's an icebreaker, but also for people who are, for service providers who might have clients who need access to sexual health services, they won't always articulate what the need is in a professional language. So when I first started volunteering for THT a while ago, I used to do a meet and greet at the MOT clinic up at Nine Wells, and a lad came in and he was very nervous, really, really nervous. So I took him into a little room to try and calm him down before he went for his consultation. And I asked him why he was so nervous. And the first thing he said was, "Oh, well, I fucked this bird on Saturday night." And I really tried very hard to keep this still.
Yes.
And then you realise that, he wasn't being misogynistic in the way that he spoke. That's just the way that he speaks.
Yes.
And as a professional, I need to be able to understand that, and I still need to be able to communicate with him and find out what's wrong with him.
Because if you challenged that language, then you would have created a barrier right away and not had the relationship with him, and it's not needed.
And trust
you know what he was asking, you know what he was saying.
Yeah. So, when someone sits down in front of me and uses whatever language, it doesn't bother me. I might not use the same language back, but it's key for them to understand that I know what they're talking about, and I'm not there to judge. We're not there to judge someone by the way that they speak or whatever language they use, as long as they're not being abusive.
Yes. Jimmy, I remember I called you a couple of years ago, and like that, around the language and around the students and their needs, and bearing in mind lots of our students are young and they're experimental and they're going through this brilliant journey, and one of our students came into the office one day and said, "Oh my God, Katie, I need help." And I said, "What's wrong?" And he says, "Could I have given the girl an STI if I snorted a line of coke and then jizzed inside her?" And I'll never forget, Jimmy, you might not remember this because I used to have all these conversations with you. I'll never forget. I tried not to raise my eyebrows too much and then just tried to be really professional and take it all on board and said, "This is a longer conversation and Jimmy will be coming in 2 days' time. You could talk to Jimmy about it." And then I actually phoned you to get a bit of advice. And I think this is what we're missing. during lockdown, you know, that we don't have that presence on campus for students to come and colloquial talk, the way they talk, using the language they use and express how they feel and get advice, you know, and can't wait for that to return.
No, neither can I. But the answer to that question is yes, he could transmit an infection, because the infections that he has been at risk of contracting by snorting coke, hepatitis C and HIV.
I remember you telling me that, the hepatitis.
And
Yeah.
they're both bloodborne viruses, they both live in sperm. So having sex with anyone, if he penetrates them, ejaculates inside them, or comes inside them, yes, there is a risk.
Yeah. There you go. Thank you very much. That's a great note to end on, Jimmy. So I think our key message then, our key message from this last Facebook Live is have great sex.
Have great sex.
Be safe.
Be safe and get tested regularly.
Brilliant.
Casey, thanks so much. I've really enjoyed this.
Oh, thank you, Jimmy. I really enjoyed seeing you. And next time we'll have a real cup of tea at a real cafe somewhere.
Exactly.
Okay, thank you very much. Thanks, everyone.
Take care.
Bye. Bye.
Bye.